Good afternoon. My name is Rich Napolitano. I am the Chief Strategy Officer at Greater Lawrence Family Health Center. And we thank you for joining us today on National Stakeholders Day, a day that we celebrate during National Health Center Week every year. National Stakeholders Day is actually a recognition of you, our stakeholders, our community leaders, our patients, our delegation, local, state, and federal. And we thank you for joining us here today. Today, we're going to have a special announcement that has everything to do with what we provide for our patients in the community. What I'd like to do now is get on with our program, and I'd like to introduce our President and CEO, John Silva, to take us through the program. Thank you.
Thank you, Rich, and thank you everyone for joining us today in this very, very exciting and important announcement that we're going to be making. You do know, all of you, that this has been a very difficult time for our community and for our country due to COVID. It's been especially difficult for Greater Lawrence Family Health Center to both provide primary care, behavioral health services, as well as face-to-face patient visits and infection control visits. I am very happy to announce publicly that our Keeping Our Promise capital campaign is underway. The campaign is to make some significant changes, alterations, and renovations at our health center hub at 34 Haverhill Street in Lawrence. Many of you know that facility right down the hill from Lawrence General Hospital houses our largest pharmacy, provides the most patient visits, and also serves as the headquarters for our nationally recognized Lawrence Family Medicine Residency Program. The purpose of the public phase of this capital campaign is to accomplish three specific changes within 34 Haverhill Street. The first is improving patient flow and access on our main floor. For any of you that have had the opportunity to go to 34 Haverhill Street, you will know that our first floor is similar to Grand Central Station. We have our huge pharmacy on one side, we have our patient registration and waiting area on another side, we have our lab services in a corner, and there's an awful lot going on, one entrance in and one entrance out. What we're planning to do is to create two separate entrances, one to access our pharmacy and one to access our clinical services and our registration area. Our second priority is our need to increase access for women's health and behavioral health services at our central hub. To do that, we are creating a behavioral health suite on the second floor that will be able to accommodate the growing need for behavioral health services that we are finding with our patient population, especially during COVID and the last few months and the months to follow. Behavioral health issues have increased dramatically due to isolation, due to fear, due to being cooped up in homes. So that's priority number two. And priority number three, in some ways, is the most important, looking at our future growth and our future stability. We have a family medicine residency program that was started in 1994, and it was started with 12 residents. It is now 2020. We have 41 family medicine residents in the same space, in the same location. So we will be renovating our first and second floors to expand and improve our residency headquarters. This means better training areas for our residents, better meeting and conference areas for our residents, better continuity and experience for our residents. This will allow our health center to continue to serve our patient population and to grow. 41 in a space of 12 residents has been difficult, but we've made it work. There are demands for us to expand that residency program every year. To do that, we have to renovate and expand our residency headquarters. It is important to note, though, for all of you, this will not reduce our clinical services, our clinical access, our clinical exam rooms. It's a three-phase capital campaign with the ultimate result of having 34 Haverhill Street be more user-friendly, be more competent in providing and expanding behavioral health services, and supporting and expanding our family medicine residency program. The next segment of this presentation and announcement will be handled by a number of folks joining us to voice their support for this project. Those voices and people that you will see and hear include Lawrence Mayor Dan Rivera, two significant business leaders in our community, Jonathan Isaacson and Andrew Chabin, and finally, the president and CEO of our sister organization, Deb Wilson. Thanks again for attending, thanks for participating, and thanks for your future support.
Having a health center like Greater Lawrence Family Health Center means a difference of people getting healthcare and not getting healthcare. And for us, it's really where the rubber meets the road, either in policy or in implementation. I know people are getting treated and have access to healthcare, mostly because I know Greater Lawrence Family Health Center exists. So it's clear to me that without the pharmacy operation that Greater Lawrence Family Health Center has, many people would go without medicine. Many people would find it hard to access pharmacies and would not get the wraparound services that they get by having the pharmacy in the Family Health Center. So it's a crucial part of the ecosystem that Family Health Center provides to Lawrence citizens. Lawrence is an immigrant city. It's a young city. It's a very woman-centered city. We have a lot of single moms out there. And so that this capital project campaign would focus on expanding women's health. I think it's crucial. Women run most of the households in the city of Lawrence. I'm supporting this project for Greater Lawrence Family Health Center because I don't want to grow old in this community and not have this service there for me in case I need it. You should do the same thing. Get behind this. It's important. There's going to be people in our communities, in our families, in our neighborhoods that need this service. You got to support this. Nothing better can be done to ensure that that final mile of healthcare gets met than supporting this.
The Greater Lawrence Family Health Center is a critical resource for Lawrence, for the people of Lawrence, and for the community. As a large employer in the region, we really believe in access to healthcare, not only for the community, but for our employees who live and work in the community. And Greater Lawrence Family Health Center is a critical asset to make sure that everybody has access to good healthcare resources. Without a healthy community, without healthy people, everything, as we've seen during the pandemic, grinds to a halt. And the men and women of the Greater Lawrence Family Health Center are out there daily providing critical care to people who really need access to quality health care in the region. Oftentimes, people think about healthcare as just pharmacy or just regular checkups, but there is so much more to living a healthy lifestyle. People need access, and people especially need local access to a wide range of healthcare providers and healthcare resources. For a lot of people, they don't know where to go to get some of these services or what the on-ramp is to be able to find services. With the health center, you have a local provider, you have caring people, and you have a way for people to access a wide range of the critical daily requirements that people need to live a healthy lifestyle. There are a lot of reasons that I support and the GEM group supports the Greater Lawrence Family Health Center. The first thing is that we've had firsthand interaction with the dedicated men and women at the health center. And frankly, one can't help but be impressed by their dedication and their caring and their commitment to the community. And frankly, that's where it all begins, is the commitment of good people who are really just trying to do the right thing. The other reason is that we believe that everybody deserves access to good quality health care. And that health care should be in a way that is accessible to people in the community at a very, very local level. The health center is dedicated to providing quality access to the people in the community and to making sure that all of the people in the community, regardless of who they are or what their resources are, have access to the same quality care and the same quality health care that we all deserve as citizens of one of the richest nations in the world.
Hi, my name's Andrew Chabin. I live in the Merrimack Valley, and I'm a supporter of the Greater Lawrence Family Health Center. I've been impressed with the direction and the mission of the Family Health Center since my involvement several years ago. I've had an opportunity to tour the clinic areas and find that the health and safety that the health center is providing for those in the Merrimack Valley is of paramount importance. I believe in the leadership of the Greater Lawrence Family Health Center. John Silva and Rich Napolitano and their team have been incredibly responsive in the questions that I've asked in determining whether I should be supporting the Family Health Center as a leadership donor. I've had an opportunity to tour the clinics and find that the leadership from above as well as at the clinics themselves has been superior. I've had an opportunity to watch firsthand as clinicians have interacted with their patients, and I'm incredibly impressed with the work being done at the Family Health Center. My family has been involved in several philanthropic endeavors in the Merrimack Valley over the years, including the Boys and Girls Club of Lawrence, Bellasini Academy, and the YMCA located in Lawrence. We have chosen to get involved in the Greater Lawrence Family Health Center because we truly believe, along with those other institutions, that this is a real priority at this time. I am supporting the Greater Lawrence Family Health Center as a leadership donor and as a volunteer, and hope that my work will inspire you to become involved.
Lawrence General and the Greater Lawrence Family Health Center share a common mission on behalf of our community. We strive every day to provide excellent care, and this project will certainly improve the health care we provide to our patients. Lawrence General Hospital strongly supports this campaign as it focuses on access to behavioral health, women's health, and pharmacy needs. Lawrence General is proud of our long-standing collaboration, not only with the health center, but also with the renowned Lawrence Family Medicine Residency Program. This campaign will serve our patients very well. Congratulations to the health center.
I'd like to thank Mayor Rivera, Deb Wilson, Jonathan Isaacson, and Andrew Chabin for their support and leadership in their comments today. Before we end today's program, I'd like to introduce Charlie Zanazzi, the chairman of our board of directors here at GLFHC, to offer some remarks and a message from our board.
Well, I think first it's important to know that the board is an all-volunteer board. So these are not paid board seats. These are folks that really represent the community. And we're not people of incredible means. That being said, every volunteer board member is completely behind what we're trying to do with this capital campaign. And we have 100% participation in terms of people reaching in and contributing, not only with their time, but really with their hard-earned dollars. Access to behavioral health is a real driver of so many other issues, not only from a healthcare standpoint, but from the ability to achieve really full performance for a lot of things in life. And these are things that really went unnoticed for a long time, but now we're realizing how all these factors work together. So the health center has always been out front in terms of really being the one to introduce this to the community first. Others have really been followers. And I think it's critical that over a period of really many decades now, that we also provide the infrastructure, but the needed support to continue to this momentum. My relationship with the health center goes back to 1995, when we were supporting through the banking community building the Haverhill Street facility. That's really when I got an opportunity to see the devotion that the physicians and the employed workers at the health center had to the community, how they really integrated healthcare into the community and brought it in, as opposed to having it as a place where you needed to come. Think about everything that's happened since 1995. Think about where this organization was at that point. With the really with the movement in the state to provide and expand access to healthcare, you just don't pass over a magic wand on that and say everyone has access to healthcare. There's a shortage of doctors. There's a shortage of outlets, and there's a shortage of trust, within communities in terms of where they're going to get their health care and how they're going to get it. As a business person who's been involved in the community, that there are critical components, and healthcare is one of the foundations of those components. If you're not healthy, if you're not confident in your ability to provide for yourself and your family in that manner, you can't be productive and move us all forward as a community. So I think it's critically important. The health center has always been there with every challenge that healthcare access has faced. The health center has always been able to be there first and show how it could work successfully. So it's an incredible, really national experiment, but locally incredibly successful experience. And we've always done it because we've had the support of the entire community. And it's critical that we have it now.
Once again, I'd like to thank our board chair, Charlie Zanazzi, for all of the work he has done on behalf of this health center over the last 15 years, for his leadership, for his passion, and for his commitment to the patients and the communities we serve. As I conclude my remarks and we conclude this announcement, I once again want to thank all of you for everything that you do for our health center, for everything that you will do in the future. We are the strongest federally qualified health center in the Commonwealth. We continue to grow services. We continue to improve access as we meet the increasing demand of our community. This project, this capital campaign, this Keeping Our Promise campaign will assure that at least for the next 10 years, we will have the space, the services, and the access ease to provide the quality and consistency of medical, behavioral health, and family medicine services that we have become known for. Thank you again on behalf of Greater Lawrence Family Health Center.
You know I'm counting on it, you not running. Stay with me, let it keep on coming. You and I need to hold on to you, yeah. As the world is in constant motion, you stay with me through the strange emotion. You